In 2010, geriatric patients, defined as those people 65 years of age and older, made up only 13.5% of the U.S. population. However, they were responsible for 30% of the prescription drug utilization. This topic is especially important to those practicing medicine in the state of Iowa, because in 2011, almost 15% of all Iowans were considered geriatric. This will be even more important in the future because it is estimated that by the year 2020, 56 million Americans will be greater than 65 years of age. The most important commandment of taking care of all patients, but especially elderly patients, is first, do no harm. There are a number of reasons why elderly patients are at a greater risk of being harmed. First, they are underrepresented in clinical trials. They have a higher risk of cognitive impairment compared to the younger population, as well as being at a greater risk of impairment of the other senses, like vision and hearing. As we age, the body undergoes physiologic changes that impact drug kinetics, making seemingly safe medications in the younger population potentially unsafe in our geriatric patients. And finally, geriatric patients often see a number of specialists and lack a primary care provider. Polypharmacy is defined as the use of multiple medications, or the administration of more medications than are clinically indicated. There are a number of factors that increase one's risk of being prescribed too many medications. These risk factors include increased age, white race, lower education level, poorer health, and a greater access to care. It is important to be cognizant of these risk factors as a provider to help avoid the overprescribing of medications to at-risk individuals. There are a number of consequences of polypharmacy, and none of them are desirable. It has been shown over and over again that the more prescriptions a person takes, the less likely they are to be 100% adherent to their medication regimen. Additionally, the more medications a person takes, both prescription and over-the-counter, the greater the risk for developing adverse drug reactions. Finally, polypharmacy has also shown to actually increase mortality in a handful of studies. The good news is there are a number of strategies to help avoid polypharmacy. The American Geriatric Society publishes the Beers criteria to help identify potentially inappropriate medications for older adults. The 2012 Beers criteria is the most recently published guideline and consists of a 16-page document with a number of reader-friendly tables. Aside from simply listing potentially inappropriate medications, the Beers criteria lists specific classes of medications and the corresponding recommendation for how to use that class of medication. The reference also provides rationale for that recommendation, the quality of evidence available, and the strength of evidence to support the recommendation. In addition to the 2012 Beers criteria was a section including specific drug disease or drug syndrome interactions. In the example listed here, it is strongly suggested that NSAIDs should be avoided in patients with heart failure due to a potential to promote fluid retention and exacerbate the condition. Another way to prevent polypharmacy and ensure safe prescribing practices is to conduct regular and thorough medication reviews. If there were a second commandment in geriatric medicine, it would be to consider all new symptoms a potential adverse effect to current drug therapy, even if the therapy has been tolerated in the past. There are 4 main steps in conducting a thorough medication review. First, Ensure that each medication corresponds with an indication requiring treatment or intervention. If it is unclear why a medication is being prescribed, consideration should be given to discontinuing the medication. Second, ensure that each medication is able to be safely used in geriatric patients. Utilize previously mentioned tools such as the Beers criteria or the European version called the Stop-Start criteria to critically evaluate each medication in the context of the patient's specific situation and comorbid conditions. Third, utilize objective measurements and symptomatic improvement to evaluate if the medication is effectively treating the indication. As important as it is to ensure that medications are not being prescribed without an indication, it is equally important to ensure all indications are being effectively treated. However, it is essential to be aware of the fact that geriatric targets of therapy are not always congruent with the targets established in younger patients. Finally, assess laboratory monitoring for tolerability and adverse effects, while also asking the patient if they are having any unwanted effects from the therapy. For example, determine if the patient is having any dizziness or lightheadedness from antihypertensive treatments. When you can confirm that each medication has an indication, is being safely and effectively used, and is being tolerated by the patient, it is appropriate to continue the current medication. This process should be a continuous reevaluation of your patient's medication regimen to ensure optimal medication utilization. As the population in the United States continues to age, it is imperative that the entire healthcare field understands the specific nuances of safely and effectively taking care of our geriatric population. We must be aware of patient-specific goals of care and adjust medication regimens accordingly to meet those goals to help promote a healthy aging process. With a few simple tools and an understanding for the importance of a medication review, you can work with your geriatric population to prevent them from feeling like this and assist them in feeling like this.